Hi guys, this is Dr. Bailey. I am so sorry. This is our first live stream, and so we were having a little bit of technical difficulties. Um, but the reason why I wanted to talk to you guys today is because teen depression and preteen depression is at epidemic levels. I am a pediatrician. I'm seeing kids all day. And one of the things that I'm noticing is that I'm seeing patient after patient after patient who's literally been struggling with depression and anxiety. And furthermore, symptoms that don't seem like they're signs of depression or anxiety. And so you have parents who are really frustrated. You have kids who are really frustrated. They're down on themselves, because they don't know why they're doing certain things. And then add to that, you have preteens and teens, right? So, because we know that puberty is what it is, that people go through different things during this time, I really, really, really want to talk to you guys about this today, especially because I know a lot of you are traveling. You may be home with your families, but I really want you guys to tune in and check in with your friends, with your kids. So we're going to talk about the kind of data that we're getting around depression. We're also going to then go into like signs and symptoms, and then we're going to add in puberty. So, what kids are doing at certain ages and stages. All right. So, first off, as I said before, depression is a modern day epidemic. Okay. We know that it's a serious mental health concern and that really requires identification and appropriate intervention. Now, in this day and age, what is really so frustrating, right? We would love for it to be that you just come in to see your pediatrician, or you can identify depression and then just go to a psychologist or go to a therapist. But we do know that there is a backlog, right? So we'll talk a little bit about some of the things that we can do for that a little bit later on. But again, by understanding these signs and symptoms, I'm really trying to arm you guys so that you are better equipped to deal with certain things. Okay, so first off, when we're talking about demographics with depression, this is data that was really kind of done a little bit after the pandemic. So, what they did is they asked kids about how they felt, okay, high school kids. And nearly 4 in 10 kids felt persistently sad and hopeless. Nearly 1/3, which was about 29% of kids, said that they experienced poor mental health overall. And then in 2021, more than 1 in 5 students seriously considered attempting suicide. So, to add to this frustration, there was an even bigger complication. So, for kids that had who were more LGBTQ students, female students, and students across all different racial and ethnic lines, also really were talking about having serious symptoms of depression. And nearly half of LGBTQ children said that they have seriously considered attempting suicide. Now, the thing to note is that Black students were more likely to have attempted suicide than students of any other race or ethnicity. Now, that means something in my community. I do see a good amount of African American students as well, but just because your child is not African American does not mean that they are not battling with this. So, again, I need everybody from all backgrounds, especially parents to preteens and teens, to really listen up. Okay. So now we're going to go through the normal stages of adolescence. And again, adolescence can be really, really frustrating for parents. It can be frustrating for kids. So I'm going to give you some tips where I'm just talking about what normal adolescence is. And then later we're going to talk about what maybe some signs and symptoms of depression are. So I want you to listen up so that then you'll be able to know, what's normal and what isn't. So early adolescence generally tends to happen when kids are ages 11 to 13. Generally, what this is marked by is concrete thinking, right? So everything is either all good or everything is just all bad, right? There is no in the middle, there's nothing. In terms of egocentrism, they are focused on themselves. So that means that they're hyper conscious about how they look, how they act, what they do. They feel like the whole world is watching every single thing that they do. And so it's just important to know that as well. They're very self-conscious. And again, because they're self-conscious about their appearance, they want to look good. At this time as well, you're probably also noting, if you're going somewhere that your child may not want to be seen with you or may ask you to move farther away from the curb or wherever they're going. So this is a normal thing to see at this time. And also a need for privacy. So privacy is so important to them now. So what you may start noticing is the child that always hung out with their family members and wanted to talk to you, all of a sudden isn't so excited to do so. They may be in their room, the door may be closed a lot. Even in the car, where it's a communal time, you're with the family, you're asking questions, that preteen or teen may be wearing headphones, right? Or texting or doing something other. So even if they're in a communal space, like even now, if you're with your family for Thanksgiving, everyone's sitting there talking, they may just be off somewhere. And you may have to try to do everything you can to get them in to join the family, but this is a normal thing. All right. Now, once we get to middle adolescence, which is, so if I didn't say it before, early adolescence is 11 to 13 years of age. Now we're getting into middle adolescence, which is ages 14 to 17. So we're getting into the juicy stuff. So at this age, kids are really more concerned about their appearance. They're definitely very aware of peer pressure, which may definitely peak at this age. So before, in early adolescence, the family is still kind of central to kids' identity. But once we get to middle adolescence, this is really where kids start to be focused on their friends, okay? They're very concerned about their appearance. Their friends and whatever their friends say really takes precedence in some ways over the family. Their frontal lobes are still continuing to develop. So that means like that high executive functioning. So that means their ability to make good decisions, to think ahead on consequences. So like if they're thinking, okay, I've done pretty well on this test. I've been taking this test and studying all day. So, but now if I want to go to a friend's house the night before or a party the night before, they may end up finding that, there are consequences to that, but they may not be able to think ahead. So that's why they would go out, go to that party, do whatever, instead of studying and trying to get that A on that test. They also tend to think abstractly. So they don't consider the big picture with things. What that really means is that they don't, again, like you said, like not studying for a test. So let's say they may be studying up until a time, they then may decide that all of a sudden they don't want to study anymore, just right before the exam, and then don't do well on that exam because of it. So they're not really thinking about the big picture. They're also not really thinking about how, if you're doing well in school, how that can lead hopefully to building on that education and going on and doing other things. They're really kind of stuck right where they are in the moment. And so as parents, it's really good to help bridge that gap to them, to help them see that big picture, even though they may not listen to you. You can also notice strong emotions, guys, and I'm sure you do as parents. So, strong emotions, which will continue to drive their decisions and impulses, right? If it makes them feel good, if it makes them feel like they get that sense of belonging, then they're definitely going to want to do those things. So, also at this age, because we're talking about strong emotions, this is where we're starting to see a lot of romantic relationships and possibly sexual relationships. I always think that it's really good for parents at this age to start talking to their children and have other trusted adults whose, judgment that they respect to talk to your kids as well, so that they're able to kind of figure out what situations that may be put into theoretically before they're actually put in those situations. So, there are questions now about sexuality, right? So people may question their sexuality, they may explore their sexual identity as well. And at this point, what you want to do is just be open to this. You want to listen to people. You want to listen to your kids at this time if they have any questions. And again, rely on those trusted adults to give good advice as well. Now, because you have kids that are pushing back at this time and distancing themselves, you also may have more arguments. And notice that your children are kind of pushing those boundaries. This is where they're going to want to know, like, what you're saying. They're going to question things. They're going to want to know why you're saying certain things. So it's really important that you understand that your kids are going to try to push those boundaries. Okay. They also may spend less time with family and again, more with friends. So please don't take this personally. If there's any issues, do not take this personally. All right. You want to be sensitive to your kids. You want to see where they're going. And again, just remain there so that they can come and talk to you. You want to remain open at this time. So even though your kids are already like trying to move themselves away, stay put, not wanting to talk, you always want to remain open so that they can actually come see you. All right, now we're getting into late adolescence. So, with late adolescence, generally kids have more impulse control, right? So, what that means is that they've been able to think things through. They now can make those executive decisions better. They're also better able to gauge those risks and rewards more accurately. So they know, if I study for that test, then again, I know that I'm going to have better success, right, later on in life. Or if I make this decision, I'll have a better outcome. So this is good. They also have a stronger sense of their own individuality as this time. So they'll see themselves as a person. And they also may become more focused on their future and really start looking at that. So whether it's getting a job that will build to a career, they'll be basing those decisions on their hopes, their dreams. And this is, again, where we want people to be really supportive of their kids, regardless. And again, being open. And if they have any questions, having your kids come talk to you is so, so, so important. At this time, you'll also notice that in late adolescence, that they'll start having friendships, romantic relationships, hopefully become more stable as well. And then they'll become more emotionally and physically separated from their family, right? So at this point, they're moving out, they'll be in college, they may live somewhere else separately, but either way, as parents, you always want to extend those bonds. And again, many at this point now come back and reestablish adult relationships with their parents as well. So even if, you have an early adolescent who may be moody or, just stomping around, just keep hope alive that then they come back and then have those relationships with you later. And again, when that happens, there's a way that things change. So I always notice then as a pediatrician, I have parents who are in that executive role. They'll come in the office, they'll kind of talk about certain things like my child needs this, my child needs this. But as they get older, that relationship will end up changing. It'll be a little bit more dynamic. And so that can be a challenge, but just again, have hope that it will change. So, these are signs and symptoms of depression. Now that we've talked about adolescence, it's good to talk about depression. So, with depression, you'll see changes in mood. What that means is that your child may be sad all the time. So really what it could mean is that if you're talking about something, you're looking forward to something, you're happy about something, they just may always be the pessimist, always look at the downside to something. They may also be really irritable. So what that means is that before, if you went to go talk to them or you ask them a question, they may bite your head off and say like, I don't know, get away from me. What do you want? Okay, like just asking what you want for dinner. Just basic things like that. They may be more irritable. And some parents will say, well, how do I know? I already have a preteen or teen who's irritable anyway. This would be really more irritability. And in some cases, if you kind of push that a little bit more, where they burst into tears. Hopelessness. So if you're talking about looking forward to things, you want your kids to look forward to things, whether it's holiday break, whether it's a party, whether it's what have you, you just want them to be excited about stuff. But if they're not doing that, then you really kind of want to look at everything and just wonder like maybe what's going on and ask them those questions. Loss of interest is another one that's huge. So if your child was already, playing on sports teams, hanging out with friends, had a great network, everything was good, and then all of a sudden they just kind of cut off ties, don't want to hang out with friends, don't want to go play sports, and just kind of want to isolate. And when you're saying like, hey, you used to like this, you used to enjoy this, you used to look forward to this, you really kind of want to press your kids, not too much, but you want to actually hear what they say. Why have they cut off contact with friends, right? Why are they no longer wanting to go to a party or do what have you? You just kind of want to ask those questions and always be observant and always listen to what your kids have to say. Now, you can also have changes in weight. And this can go either way, right? So you can have some kids, because with depression, you may have decreased appetite, so your kids may not eat as much. And what that means is then they can lose a significant amount of weight, but then you may also have those kids who are just eating a lot as well and putting on significant amounts of weight. Difficulty concentrating is also key. So I have a lot of parents who are coming into the office and they may say to me like, hey, I think my child has ADHD. I'm sure that they have ADHD. And, they're pushing for that. And the teachers are saying they're unable to focus. They're unable to complete assignments, or they'll work up to doing the assignment and then won't turn it in. And it drives parents crazy. That makes sense. So what we do is we go through and we test for ADHD, and what we find out is a lot of kids actually don't have ADHD. Some do, but again, depression and anxiety can actually go along with ADHD, but sometimes, and what I'm seeing now more, is that depression and anxiety can actually be the issue with focus and not ADHD. So if you have kids who you're concerned about maybe having ADHD, and again, they're not meeting the criteria, think about depression and anxiety. It is screaming there. You'll also notice fatigue. So kids will be tired, right? They're not going to want to move. They're just going to be kind of lumps, like not wanting to do anything. And then again, thoughts of suicide and self-harm are really key, right? Now, this is the thing, and I do want to hit this. As a pediatrician, I have kids who are coming in to me. Some are really sad. They're mournful all the time. They even may start tearing. They're speaking slow. That's a red flag, right? But the ones that also really can trick you are the ones who come in and they're buoyant, they're happy, they're smiling, they're very polite. And then you kind of have the ones in between. So what do we do? In our office, we have something that's called a PHQ-9, and it's just a little assessment that we do for each and every preteen and teen. Why is that important? It's important because you can't tell who's depressed. There are times where I've seen, especially, there have been ones where I'll talk to a kid, they're buoyant, they're happy, they're talking, they're amazing. And then you're asking them, are you feeling a little sad? Oh, I'm great. Okay, great. Everything's going well. Everything's going well. And then I see the assessment and I'll ask them like, hey, this is pretty high. How are you feeling? And what they end up saying is, well, Dr. Bailey, I'm not really feeling that well. But it may take time after time after time. And those are the kids that you have to be really, really careful about, because you can never know who's depressed and who isn't depressed. It's just not something that we can see. It's symptoms, yes, but the thing is that kids are good at masking this. And especially when you talk to them, they don't want to let anyone down. They don't want to let their friends down. They don't want to let their families down. And so you really have to be open to this as well. And obviously withdrawal from social interactions, as we talked about, is key. So again, especially if they're in that like 14 up age and they don't want to engage, then that's a screaming red flag. So in terms of treatment, there are all sorts of things to discuss. So we want to offer communication and support. You want kids to encourage open and non-judgmental communication with their parents as well. So what that means is just being open. You don't want to judge them. You don't want to yell at them. You don't want to do anything. You just want to remain open to them. You also want to offer reassurance and emotional support when you're validating those emotions. So what that means is that a lot of times kids, they're just like when they're babies, right? They don't know what's normal and what isn't normal. So they feel like, obviously, this is the first time they've ever felt like this in the world, and it is the most important thing. It is the most pressing thing, and they are terrified by it. A lot of times kids, especially if they are depressed, will confide to me and they say, I don't know what's wrong with me. I don't know what's wrong with me. So you definitely want to offer that reassurance and emotional support when you're validating their emotions. And you want to provide a safe space for teens to express themselves always. Just so that they feel safe and so that they can come to you. Now, in cases where they don't feel comfortable with you, and as a parent, if your teen isn't coming and asking you things, have an adult in your circle who you trust and whose judgment you trust to have your kids talk to them as well. Seeking professional help is another thing that you want to do as well. So you want to consult with a healthcare professional. Again, kids do see pediatricians, but again, we know that there's a backup in the system. There are therapists, there are licensed clinical social workers, there are all sorts of modalities of treatment. And even now, yes, there's online treatment as well. There are texting services as well. So I will give kids the suicide text line if they absolutely need to in the meantime, so that even if they're going to see a therapist, because we know therapy visits are few and far between. So what I say is then, hey, if that's the case, at least you have the suicide text line. At least you have, 988, just so that you can reach out to people in between. And then you always want to explore various treatment options, including therapy and medication as well. Look at your local resources as well. You can always call your city and see what they have as well, just so that you have a backup. But I would say you can have kind of like an acute and chronic. So the acute being, who do you call if there's a huge crisis, like if your child has attempted suicide? Obviously, you're going to try to go to the ER. There should be an inpatient psych center near you. You want something that's going to be acute. But then you also want something that's going to be chronic. So where you have a therapist, you have people in your circle or other adults who your kids trust if they don't feel like talking to you, and you also as a support. And then again, creating a supportive environment is so important. You want to collaborate with your schools to create that supportive environment. So, this is where even reaching out to the teachers, because again, we all know your kids may act differently at school than they do at home. And so, at least you want that pipeline into school to find out how your kids are acting. Are they doing something different that they aren't doing at school, at home? Very, very important. And you also want to educate your teachers, your administrators, and peers about depression. So, this is kind of why I am doing what I'm doing, because I was a pediatrician, just dealing with bumps and bruises. But especially after COVID, I've just noticed that has just trended up. Depression has trended up. And you can imagine my frustration. But again, I'm still going to treat it, but it's where I'm going in and I'm seeing kids for well visits. And we started doing depression screenings and just noted it was going sky high. Kids were really depressed. And even worse, we were noticing little kids were showing signs of depression. I would get 6 and 7-year-olds who would come in and their parents were like, they're sleeping in bed all day. They're not getting up. They're not, participating with the family. And even though I just went through those other stages of adolescence, these kids are before adolescence and they were still exhibiting those signs. So it's just always good, even if you don't have a preteen and a teen, just to be focused on what your kid is doing. If they're starting to pull away, if they're starting to really lose hope, they're not as happy and buoyant and joyous. Those are things to look for. But then even if your kid seems like they're happy and buoyant and they're telling you that everything is okay, everything's good, that's when you can ask, how are you doing? So I remember being a teen myself in high school, and I remember I'd always walk around and I would say good morning, and everyone would ask, how are you? I'd say, oh, I'm fine, thank you. I'm fine, thank you. And I remember I was taken aback when somebody actually really asked me hey, one day when I was walking by them, how are you really doing? That is something that you really may have to ask your kid. So even if they're giving you the song and dance of everything's great, my life is great, everything's put together, well, that's great. But how are you really feeling? And see if they'll open up. If they don't, there is nothing to fret about. You have people in your community who care, whether it's religious leaders, whether it's therapists, whether it's pediatricians. There are people there who can help you and build that team. So I really do want to stress that for you guys. Do not give up. You want to encourage a healthy lifestyle as well. So part of teen and preteen growth is sleep. You need you need sleep, right? Adequate sleep. So 7 to 8 hours. And in fact, sometimes teens need more than they did as little kids because they're constantly growing, right? In that first year of life, yeah, they're growing exponentially, but then now they're really growing, right? They're growing, they have all these hormones, they have school, they have work. There are so many things that they need to do to function. And on top of that, they're growing exponentially. So they need that sleep. You want to keep regular physical activity going. Now, they don't have to go to the gym every day, but even just going out, getting a walk will really help. Fresh air is actually really good for mood as well. Getting that sunlight, getting the heart pumping and everything really helps. Obviously, nutritious eating habits are great. So essentially what you want them to do is just eat well. And you will notice this as well. So if they're drinking a lot of water, if they're eating a lot of, fruits and vegetables, that will help boost their mood, right? It's not going to be heavy food. It's not going to weigh them down, not hard to digest. It just will help them feel better. And then you always want to encourage your teens to engage in healthy activities, whether that's sports, whether it's drama, whether it is whatever it is, especially at this age so that they can begin to express themselves. So again, identifying and treating depression in teens really requires a collaborative effort. Again, you guys as parents want to team with educators, healthcare professionals like me, and the broader community. Do research in your community to see who will help support you as well. And again, you want that acute and chronic settings. So it's kind of like the chronic would be more the therapy and things like that. But then if there's any issues, like if there's an emergency, especially a mental health emergency, you want someone on speed dial so that you can call and take your kid there immediately. You really want to have a game plan just in case. And by recognizing the signs of depression, providing support and understanding, and seeking professional help when needed, and promoting healthy lifestyle habits, we can help teens and preteens navigate their mental health challenges and thrive emotionally. So I really do hope this helps. I wish you guys a very, very happy holiday. Again, this is our first live stream, so I do apologize for the early technical difficulties. But if you have more questions, please reach out. Our website is www.askpeds.com. Again, this is our YouTube channel, Ask Pediatrics. And we also have a TikTok channel as well. We will be doing more of these. So again, this is our preteen and teen series, but we're gonna have a baby series, a toddler series, and also school-age kids. And we will have guest speakers as well. So please tune in the future. Thank you. Have a great day.